Radio Cairo. What's going on? It's live. And that's the road. Live on the road.
Hello everybody over there and welcome to a new edition of Life on the Road, brought to you by the European Service of Radio Cairo on FM 95.4. Today we are concerned with the World AIDS Day. Egypt marks the annual World AIDS Day on December 1st. Celebration is part of a national campaign designed to raise awareness about HIV, enhance prevention efforts, and move the various sectors to address the stigma and discrimination that surround people living with HIV in Egypt. So our guest online is Salem, Community Support Advisor, Regional Support Team, Middle East and North Africa. Salem, first of all, concerning the virus and disease, what's the status of the Middle East and North Africa?
The Middle East and North Africa, when it comes to HIV, is a little bit concerning because whereas most of the regions of the world are either seeing plateauing in the figures or even decrease in the number of new infections, we see that in the Middle East and North Africa as well as Central Europe, these are the two only regions in the whole world where the infections or the new incidence of HIV are increasing. We still are among the lowest prevalence, so the prevalence is still low, but we are talking about more figures escalating every year. We also, when it comes to treatment, we see that our region is unfortunately also among the lowest. So we have almost 20% treatment coverage, whereas it should be much, much more than that. And also we do have a very low prevention from mother-to-child transmission, which means that new infections among children is also increasing, which is definitely not something that we would like to see with all the technology that's going on and the treatment feasible right now.
Would you tell us more about the role of RST, or Regional Support Team, Middle East and North Africa?
The Regional Support Team for UNAIDS tries to play a strong role when it comes to maybe three things. First of all, we do have a strategy for UNAIDS that we would like to see happening in this part of the world, which is the fast track. We call them the fast track targets. And this is what we want to see, the new infections decreasing, and we want to see more of prevention taking place. So, and I can explain about the fast track targets. It's like we want to see more, we call it 90-90-90. You will hear a lot of that when it comes to speaking about HIV nowadays. So it means that we want to put 90 people who do not know that they are HIV, understanding their status. So basically putting 90% of all people who should be having HIV to know that they are HIV positive. Now, and then 90 of these HIV positive people, we need to make sure they are already on treatment. This is the second 90. And the third 90 is 90 people of these already on treatment have viral load suppression, meaning that they are living healthy lives with no viral load, or their CD4 count is very high. So this is where what we would like to see as in the regional support team. The second thing we work on is a political commitment, and for that we do have a regional Arab strategy that we had developed 4 years ago with the League of Arab States. And this strategy does have 10 targets that are extremely important and in line with most of the global targets on HIV. And it's really very important to see that the Arab Council of Ministers of Health adopting this strategy, trying to implement it alongside UNAIDS. In 2015, we had new resolutions on implementation of the strategy, and in 2016, they were calling the Arab ministers for fast-tracking the HIV response. They understood that we have a problem. They understood that this region is, if we do not take any action, we will be really going into a serious problem with the new cases. So they all called for that. Now, for the implementation, we are trying to put also a kind of a monitoring and evaluation and an accountability framework. So everybody is held accountable when it comes to HIV.
Celebration is part of a national campaign designed to raise awareness about HIV. So, do you mind to tell us more about your role in working with the HIV virus and AIDS, including prevention and treatment?
My particular role is working with the community. So, for example, we do have very strong regional and national networks of civil society working on HIV. We have a very strong two regional networks, one called RANA, Regional Arab Network Against AIDS, and one called MINARA, Middle East Harm Reduction Association. Both of them are working very closely with key population, whether they are men having sex with men or with injecting drug users. And these regional networks have affiliations to national civil society, which are able to reach these key population and provide the services to them. My work with the community also makes sure that I build their capacity. I make sure they get enough funding to support their these activities, because, as you know, the financial contribution from the countries as domestic funding to HIV is very minimal. So most of the funding that is directed towards prevention comes from outside sources. So we want to see more money coming into these countries and supporting the civil society work. We also work closely with the people living with HIV, the affected population, as we call them. Most of these people living with HIV have no means of to support them in terms of finance or in capacity building. So we also work with them. We help them to stay adhering to treatment. We help them to get some social protection with their governments or with the private sector sometimes. We link them with referral services. As I said before, stigma in the health facilities is the most, hard to see among these people. You always expect doctors to be the compassionate, giving you the support you need, especially that they are more knowledgeable about means of transmission than the normal layman. But unfortunately, in our region, we see a lot escalating cases of stigma among these people from the health facilities, whether in providing them with treatment or in the healthcare in general. So we find difficulty in people accessing surgeries, accessing obstetric care when it comes to women delivering, accessing normal dentistry, and even the family practitioner is not there. So these are things we try to help these people through getting them referrals to certain people, doctors and physicians who are sensitized and helping us in this area. We also help them for their when it comes to their legal rights. We tell them what they should be accessing and how to be able to, if they don't access it, to call for their right to do so. So we do give them legal literacy. We tell them where to go and so on.
In light of launching the Sustainable Development Goals 2015-2030, third of which has recorded the achievement of good health, partnership, and gender equality. So how do you see yourself in this international scene, and what's the role that can be achieved through your activity?
As you know, the SDGs have come to really say that people should be at the center of development if we want to achieve something. And the SDGs are all cross-cutting in a way for inclusive societies and making everybody accessing good quality lifestyles, whether it's health or dignity or social protection or whatever. And HIV has always been, we always call it, it's not an issue, it's not a health issue only, it's an issue that, has economic, social, cultural, religious dimensions. And that's why when we look at the SDGs, we see that we should not only be working with SDG 3, which is the inclusive, which is the health for all or comprehensive health for all, But we do look more into other sustainable development goals, like, for example, reducing inequalities or gender equity or partnerships, so where we would be able to help HIV get more funding and more partners coming in to help with the interventions we do. Or, for example, if we want to work with SDG 16, which is the peace, justice, and strong institutions, here we can really see our work interlinked with when we try to eliminate punitive laws that do not allow people, accessing services. For example, the drug users who are criminalized, people do not look at them as patients, but look at them as criminals. How we can change some of these policies and laws to make it a very inclusive community. These people can access services to prevent HIV infection or other, blood transmission infections, but at the same time they can be integrated into their communities and live a normal life. So if you look across most of the SDGs, you'll find that HIV is there somehow, one way or another. So what we try to do with our UNAIDS strategy is to try and link most of our activities within these SDGs, and also, if you have heard, there has been a political declaration in June 2016, this year in New York, where all heads of states, through a high-level meeting, had endorsed a political declaration where they are saying that yes, we would like to end AIDS by 2030. And to do that, we need to work closely, and all of us together, in making sure that these SDGs are inclusive of all the targets of HIV, especially the fast-track targets, where we would like to put most people on treatment, where we would like to make sure prevention is there for everyone who is seeking it, and that they get all these services with no stigma and discrimination whatsoever.
Through the annual campaign, national stakeholders are successful in mobilizing key actors such as media. So how do you see the role of media and social media regarding the recommendations that could be applicable?
This is a very good question. Thank you very much for bringing it up. We are working within the Arab AIDS strategy. We have in our plan, and this is happening on the 4th of December next month, because we are celebrating World AIDS Day, we thought this year we would make it a day for the media. So we are having a workshop in the morning where we're bringing all the media leaders to be thinking together with us what are the key messages that would make impact on the community, on the health facilities, on all the people who would be dealing with people living with HIV, or how to deal with people living with HIV. So we will be producing key messages and also some recommendations for the media to take forward, and they will be presented in our celebration on the same day in the League of Arab States. We believe the media has a very strong role to play. We've seen how sometimes wrong media can really jeopardize most of the work that we've been doing. One word, one wrong media message can get people, not being able to access services, or a TV news that says people die from HIV. They give the wrong message that there is hope and there is treatment, and HIV is not anymore a deadly disease if it's well treated and early detected. Also, we believe that drama plays a very strong role, and part of our where we would like to see more of, examples like Asma. Asma has been a very interesting film that was produced 3 years ago and done by Hind Sabri, the famous actress. And in it depicted the normal life of a very, simple woman living with HIV, how she managed to bring her daughter up living in a very stigmatizing community, and how she manages to get her rights and people to be respecting her and working with her. So you put a human face to the person living with HIV. These people are among us. They live with us. They are not, like numbers. They are faces. They are human beings. And I think only the media and the drama in particular will be able to convey this message. we have a lot of hope on Yusra, our famous goodwill ambassador, to make sure that media picks this up. And when someone who people trust and looks up to brings that message forward, it's much more easily digested and able to be appreciated. So definitely, if we are to bring down the levels of stigma and discrimination against these people in the communities, it will only be because we have a good media partnership and strong coverage.
Okay, we need to encourage young people to engage with civil society and other stakeholders to spread awareness about HIV and services available in Egypt. So, what are the activities of UNAIDS program?
From our, as I said, because we are so much concerned with fast-tracking, with making sure that these figures go down and we put so many more and more people on treatment, our activities are mainly working on fighting stigma and discrimination. You know how much stigma and discrimination are among key populations, or who do we call them key population, are people who are most prone to have the HIV. Like, for example, people who inject drugs, men who have sex with men, or sex workers, and of course their partners. And these are the new figures we are getting, that it is not anymore within the key population as much as with other partners that they are interacting with. So from there, we want to make sure that people go for testing. We want to make sure that people go for treatment. And for that, we need really to work on the stigma and discrimination at community level as well as in the health facilities. It's been very, very unfortunate that we have been noticing so many figures of stigma at the health facilities for these people, especially those who are, like from the key population. And we're trying with WHO to work on that, but also we are trying to work with the community. So our role or our activities are mainly to support the civil society, who are the most able to reach out for these populations and help them, through community testing, through distribution of combination prevention methods. When it comes to drug use, for harm reduction policies, distributing new syringes so that people do not share syringes when they are, taking drugs. And definitely we try to work a lot on the issue of stigma with the advocacy of people who have a voice, who can reach to others. So, for example, last year we appointed Yusra, the famous movie star, as our UNAIDS Regional Goodwill Ambassador. And actually, Yusra had been doing a great job with, fighting the notion of HIV being a taboo, that people should be speaking about it, that we should not be afraid, and people should go for testing, and that it is a very normal disease, as much as, if you are diabetic or if you have high blood tension, all you need to do is really take some medications a day, and that's all. And same for you and for the HIV. If you do know you're HIV positive, you take the treatment, once a day pill, you will be living a very normal life, nothing whatsoever. Plus, treatment is prevention. So we also tell people that it's important for you to adhere to treatment, because if you adhere to treatment, you have 96% prevention. So to those who are around you, So it's really a very effective way of making sure you stay healthy and also you protect those around you.
Concerning the idea of the annual celebration of International Day of AIDS, December 1st of each year, celebrating this year, you are focusing on prevention. So, what are the means of UNAIDS program to achieve it?
On prevention, the World AIDS Day logo or slogan this year is Hands Up for Prevention, with everything that includes that. So, for example, we're talking about preventing mother-to-child transmission, meaning that we would like to see more pregnant women going for testing. We'd like to make sure that testing for HIV is in all the antenatal clinics. We have countries like Oman and UAE in the region who are going to almost eliminate mother-to-child transmission. So this is one way of trying to prevent, which is a very important and effective way. The other, what we talk about is basically, of course, trying to make sure people who are prone to get the HIV through, for example, risky behavior, are aware of what to use. For example, condoms, or those who are injecting drug use needs to know that they should not be sharing syringes with others. They need to understand more and more about what how the transmission of the virus comes, like, hepatitis C, hepatitis B, all the blood viruses that can be caused through using, like shared syringes. The third thing is basically telling people that they need to be just aware of their health, a healthy lifestyle, and if they go on treatment and make sure that they adhere to it, then definitely they will be able to protect themselves and those around them, because treatment, as I said, is prevention. We also have a slogan called the life cycle approach to HIV, which we call for people to start free, stay free, then they will be always AIDS-free. And again, this is the idea of from the newborns up to living a normal life with a healthy lifestyle. You will be living like as long as you can. HIV is not anymore a deadly disease with the right, with knowing your HIV status early on, so we can detect the viral load before it gets worse. And you know that HIV, when it's left untreated, it gets into AIDS, and AIDS is definitely a fatal disease. So before reaching that stage, we can definitely make sure people live a long and healthy life.
Simone Salem, Community Support Advisor, Regional Support Team, Middle East and North Africa. We wish you all the best of luck. Many thanks for your time. And now that's it for today's edition of Life on the Road, brought to you by the European service of Radio Cairo on FM 95.4. My special thanks to Muhammad Mustafa at the controls, and this is Mona Hosni wishing you a lovely day.
Life on the Road with Mona Hosni.